Welcome to Be Well with MS podcast series, where I and expert guests discuss science and science-based tools for everyday life to preserve brain health and quality of life living with MS. I'm Dr. Agnes Trokjane, neurologist, researcher, innovator at Torbay and South Devon NHS Foundation Trust in the UK. So today's guest is Professor Helen Ford. Helen works with a multidisciplinary MS team based at Leeds Teaching Hospital, NHS Trust. The team provides a local service for people with MS in Leeds and tertiary MS treatment program for the West Yorkshire. Most exciting, Helen is clinical professor of neurology at the University of Leeds. Helen's research interests are in social determinants of health and MS, patient-reported outcome measures, treatment decision-making, employment in MS, kinematic measurements of upper limb function, which is a very innovative way of looking at the MS disease, gender and intersectionality in MS, domestic violence, abuse, and clinical trials. Helen is the clinical lead for Yorkshire Brain Research Centre, rising the profile of brain research. For me, Helen is a role model of very established and well-known women neurologists in the entire world. I first met Helen in 2019 when she was one of the social determinants of health workstream lead for Rising the Bar initiative. Helen has an extensive knowledge in MS and is one of the first women neurologists and MS specialists running MS service in the UK very, very successfully. It's a great inspiration to follow Helen, clinical and research work, and I always enjoy attending the conferences when she delivers the presentations. And I also reading her publications, and if you wish to follow Professor Ford, she's also very active on the Twitter, so do follow Professor Ford online. She produces a lot of nice content to dig deeper and read about things. So ladies and gentlemen, so please welcome to the show, Professor Helen Ford. Hello, Helen.
Oh, thank you so much for such a kind introduction, and it's great to be with you and to support your podcast, Agnew.
Thank you, Helen. So it's really nice to have you on the show, and I really have a huge honor to interview you and just spend a bit of time talking to each other and have a support peer-to-peer to understand such a complexity. Today we're going to talk about social determinants of health for living with MS and what the impact it is on overall on this condition. And because this initiative is based on the brain health and how to preserve brain health. So my really first question to you, Helen, is what does that mean, brain health, to you personally? And maybe you could take us through your morning or evening rituals and what the 60 minutes of your day look like.
Okay. So it's interesting to think about brain health because it's come to the fore really over recent years. Whereas when we think about it, Healthy Heart has been an initiative that people have been quite aware of for a long time. So, I mean, we can't think of your healthy heart in isolation. We need to think about brain health and how we preserve, our brain health as much as possible. So, I mean, for me, I think brain health is about how we live our lives, and it's a lot around thinking about what do we do to maintain our physical health, but also our mental health as well. So, we can't differentiate between those two things really. One of the things for me that I think has helped in recent years is I took up running about 5 years ago. So as a child at school, you have to run, don't you? And in senior school, we did cross-country running, but I didn't really continue it after that. But you mentioned our brain research appeal, which is a fundraising appeal to develop brain research. And so the team wanted to do a 10K run, and so they wanted me
what a challenge.
Yeah, I know. So they wanted me to join, and at first I thought, well, absolutely not, I won't be able to do that. But then one of my lovely consultant neurology colleagues is actually a coach in a running club. So he was really supportive and just sort of about, that gentle sort of couch to 5K and then building up from that. So, and I think for me, it's been great actually, because I think thinking about both my physical health has improved, but also I find running is a great time to think. So I don't run long distances, and I might, you asked me about my normal day. I'm very lucky because I live in Yorkshire, near to beautiful countryside. So I'm able to go for a short run in the woods from my home. And I think can either, at the start of the day, just clear your head for the day and think through things. Or even if I run at the end of the day, maybe tricky things that have come up in the day, you can think through. So I think doing that has been quite life-changing for me, actually. Yeah.
It's a very mindful activity. You almost spend that all time for yourself, for your body to nourish, to nurture yourself, and that allows you to provide the best care you can to your patients, of course. And it's really looking after yourself, because all these physical activities, perhaps, as we know, it really gives you more energy, and you're more present and more mindful, and you can provide care and be at your best, and your performance increases, of course, and that applies to anybody. And I think I'm so glad to hear that. It almost feels like you establish your routine, and you found yourself that you could be a good runner, and you could do long miles.
Yeah.
It's just setting these goals and trying to achieve them, in a very sort of a structured way. It doesn't happen over the night. It's something that you build up, and it's only an inspiration for everyone to follow and do things as you do, Helen. So maybe moving on to more science today, and talking about such a complex concept of the social determinants of health, which is purely a sort of a public health, isn't it? And it covers a lot of aspects in our lives, and it's such an important topic and subject to discuss, I think. But for majority, it might be for our listeners, for example, it might be something that is a new concept. It's something that they probably never heard about, and maybe we could perhaps cover what the social determinants of health means, and how it's linked to MS. And let's just sort of dig deeper a little bit into the science and see what the important role it is of the social determinant of health, and why it's important.
Yeah, so I think one of the things that made me really passionate about working in social determinants of health is that appreciation that every person with MS is different, and every person with MS faces different life challenges. And also, despite the great success that we've had with disease modifying treatments and the wonderful developments over the last 25, 30 years, people with MS still face different issues, and not all people respond in the same way to disease modifying treatments. So I think there are other things going on. And when we think about social determinants of health, what we're thinking about is the conditions in which the individual person is born, grows, lives, works, and ages. So it's those situations for the individual. And what I find quite useful to think about is how we divide those up. So I think it's important to think about the factors that are specific to the individual, and then what we call more structural factors, which are the factors associated with the societies that we live in. So in terms of the individual factors, that's related to our sex, gender, race, ethnicity, and then important things like education, employment, your socioeconomic status, and your safety. So you mentioned at the start, an area that I am working in is domestic violence and abuse in people with MS. So all of those factors are factors about the individual themselves.
Yeah, it sounds like it's really important factors. And it almost, if we summarize that, it's probably covering biology. So gene, sex, gender. It covers the social aspect, the living in the community, socializing, working, not working, and it's environmental as well. So what's happening around you, and whether you work or not, what your income and education is. So So all these factors influence how we perform, how we live our lives, and what our general health is, isn't it?
Yeah, absolutely. And then linked to that then are the sort of infrastructure we have in our society. So, and this varies internationally, of course. So our access to healthcare is really important, access to food, thinking about other factors in our environment. So, for instance, air pollution, does that have an impact on MS? And then really importantly, social support for people with MS.
In a way, there are aspects that we don't choose. If you're born in Africa and if you're born in Australia, your lifespan is completely different. So in Africa, you may live up to 52 years. And then in Australia, on average, the lifespan is around 82. So really, these are things that not necessarily we have a chance to choose. It's the way it is. And the main focus here is to optimize our health with a given situation, within an environment, a society that we live, isn't it?
Yes, I think so. But I also think to take the opportunity to influence society in which we live. So I think that, as MS neurologists, that we do have a role in being advocates for our patients, the people that we see who are living with MS. And also we have a role in understanding what local society is like for them, because even in a relatively small country, really, in the United Kingdom, there are big differences between different areas, and we know that the local populations vary and level of deprivation varies. So we can't directly influence some of the conditions that we live in, but we can strive to improve access to healthcare services, to look at how people with MS navigate healthcare services, to signpost people if, for instance, people aren't aware of, are having problems with food access, aren't aware of, local services that will support them. And also not to think that neurologists can obviously influence everything, but to work really well with our primary care doctors and primary care teams and community rehab teams, so that we're just striving to do the best, really, in whatever circumstances we're in.
Yeah. And I guess, with this talk here, we're trying really to influence the governments, the policymakers, that it's such an important aspect in people's lives, and that needs to be adjusted, changed. And I think it's a great example in the current the world situation and Ukraine's war, like how countries are supporting the most vulnerable country at the moment with the food supply, medicine. So it's a great example. How can we establish these relationships and connection and networking and helping each other? It's amazing. It's an amazing example.
Yes, I mean, so crucial. And I've seen some interesting work recently with Pakistan as well, around sending disease-modifying treatments for people with MS living in Pakistan, because, as you know, Pakistan has been subject to devastating floods. So, yes, I mean, I think having, that global view as well of MS is really important.
Yeah. Wonderful. So tackling this MS at the moment and looking at the disease activity that is influenced and impactful by the social determinants of health, what's the current evidence we've got? Any sort of meta-analysis or any data to indicate that if people live in certain countries, or they are not educated, or they are less successful and vulnerable economically, how does that affect the disease activity and progression and brain volume loss?
Well, that's a really pertinent question, actually, because I've recently been involved over the last year with an international collaboration looking at social determinants of MS and their effect on disease outcomes. So it's been a really broad scope of work, and we've had representation from the UK, from Australia, from Belgium, from Colombia, from the US. So we've had a wide spread of collaborators, MS neurologists and researchers in MS. And actually, we've just been published online in Nature Reviews Neurology. So it's a really comprehensive review of these different social determinants of health. So it was published online on the 11th of November this year.
And what's the key messages from that policy, Helen? If you could just summarize a couple aspects in general.
Yeah, so the key messages is we've tried to cover the research that's been done in all of the different areas of social determinants that I've highlighted. And, there is variation between different countries. There's strong evidence around race, for instance, in the US having an impact on MS disease outcomes in terms of more rapid progression. There's been very good work from Wales looking at socioeconomic status and its effect on progression in what we call the EDSS score, which is a measure of MS disability. And, there's sort of emerging evidence in different areas. I mean, one of my areas that I'm quite passionate about is employment and MS. So, obviously, there are multiple factors that contribute to people with MS losing their jobs, but there is also emerging evidence of the impact of unemployment on people with MS. So there have been studies showing worse outcomes for people with MS who are unemployed. So, I mean, I think it's a call for action, really, our work, because it's saying, what we're saying is that these factors are important. We need more research in these areas, and we need to look at how we can modify different factors. And when we looked at screening for social determinants of health, actually, it's only in employment really that there are valid screening measures. So we also, one of our goals was really how can we guide neurologists? And we did find a screening tool that has been validated in other medical conditions called the Core5 screening tool. Which is useful in clinical practice because it's a short screening tool, which has been published in the BMJ, and we've slightly adapted it because one of the big differences across the world is we're fortunate to live in a country with a universal healthcare system, but if you live in a payer system where you have to have health insurance, then there are other issues. So we've added an additional question about that.
Wonderful. And based on this measurement and the questionnaire, can you predict the worsening of MS disease if you know already the socioeconomic status, gender, ethnicity, employment, education in advance? Can you tell that this patient is going to do worse in contrast to another, and that would be something that we would probably need to implement in our clinics as a prediction modeling and planning future medicine?
Yes, exactly. I mean, I think that's the first thing to do is to start to screen for social determinants of health. And I've been concerned that perhaps because the focus in the MS clinics has become so much about disease modifying treatments that we're perhaps not asking people as often as we should about their employment status, about their living conditions, and how they're coping. And our MS nurse team have a sort of structured protocol that they work through when they first meet people with MS, but it's important that we keep asking those questions because people's life changes, as we all know. And so it's all very well to, for instance, ask about employment at the time of diagnosis, but we need to know if work's becoming more difficult for people with MS, and we definitely don't want to wait for people to become unemployed. We need to support people at an earlier stage.
Yeah, absolutely. So it almost feels like it's a bidirectional effect on outcomes. If you have a poor health, you can't work, and sometimes the work influences the way you feel. It affects your health too. So it's not just one direction way. It's bidirectional. I think the way we look at the things, and it's really impactful and game changing effect. And do we have any data around people who are living with MS and require regular access to food banks. They are unemployed with low income. So do we have any sort of statistics and percentage in the UK?
I don't think we have any data around that. When we looked at diet and food, actually most of the studies in MS are really based on food supplements. So there really are actually very few studies even looking at food quality, so actually having a well-balanced diet. So, and there was a recent, I think in 2020, a systematic review looking at the studies in diet, and really, really most of the studies were felt to be quite poorly designed, actually. So I think, access to good quality food, not just quantity of food, is really important for us to understand. And I just don't think, but without research evidence, that we ask people about access to food. So I don't think we have that evidence.
Okay, Helen. So the other aspect I was thinking about is, people who are more vulnerable, they tend to be more fragile. They have more illness, more comorbidities, and according to our recent audit locally at Torbay Hospital, we looked at the statistics, and people who are socially more deprived, we measure them by deciles from 1 to 10. Mm-hmm. We noticed that people who are more vulnerable, they do tend to attend more emergency department, and more hospital admissions are being recorded. I think that the difference is 15% higher activity at the hospital. Mm-hmm. And do we provide care equal to everyone, or do we have even maybe more data around this, the hospital admission attendance, if you have if you're socially deprived?
Yeah, so I think the issue is that there are many factors that go along with social deprivation. So you may be more likely to smoke, you may be more likely to have obesity. So there can be other factors. And I think we need to think the comorbidities that people with MS are living with. And, how well are we working on preventive health, and how well are we working on health screening programs? So there is evidence that people with higher levels of disability with MS don't access the same general health screening programs, and also don't have the same preventative strategies in place, really. So I think there is, some evidence of that. It is multifactorial.
Wonderful. It's really good to know that. And perhaps that's the area that we need to all, as a team, as all the healthcare providers working in MS, come as a team and put the effort to improving the access to people, because there's no other way. It's very, very beneficial. I've got a little audience in the background, and he is seeking some attention and throwing everything now from the shelves. Helen, it doesn't happen that often. You have some charisma that attracted him. So, yeah. It's once every 6 months that he comes in.
Yeah.
Okay, Helen. So moving on to a bit of a screening of the infection and then COVID pandemic. Mm-hmm. Has the situation changed, and how does that affected employment, inequality, hospital admissions, loss of jobs? I heard so many stories, the redundancy and reduced income. And do we know anything related around MS patients at all, like how they were impacted by this change?
Yeah, I mean, I think there were some positives for people with MS in terms of employment, because people with MS have often struggled to get reasonable adjustments to their working lives. And under the Equality Act, MS is one of the few conditions where the Equality Act applies right from the point of diagnosis. So it is not related to your level of disability. And I don't think a lot of people with MS are aware of that. So it's one of the few conditions named in the Equality Act. Now, what some people with MS found was actually reasonable adjustments that they'd asked for quite a long time suddenly came to pass in the COVID pandemic, because obviously there was a switch to being able to work from home. And, working remotely for some people was really beneficial for their working lives, because as, everyone with MS knows, that if you are going out to work and you've got to get ready in the morning and then you've got a commute, and if you're driving, find a parking space, get to work or travel on public transport, it can be exhausting. So by the time you start your working day, you can be really exhausted. So I know that some people with MS found that actually they managed work better during the pandemic, and that has led to us being more flexible since the pandemic. So that has been useful. I mean, we were involved in a project on employment and MS during the pandemic, actually, and looking at trying to improve resilience and self-efficacy for employed people. So we have got some data around the impact of COVID on employment and what happened to people with MS during the pandemic. And also we asked people about changes to their jobs. We asked them about their commute. We asked them about the adjustments that they wanted, but also we asked them about the time they had off from work. So we have got some data that we will be publishing around that area. So for other people, obviously, some people couldn't work at all during COVID. So as we know, some sectors closed completely. And I think that we have seen it in our clinics, that led to a lot of deconditioning for people with MS. So people found, even people who had, a level of disability, found that they were at least going out and going into work. But then when they ended up just at home, then there was physical deconditioning, but also social isolation. So they were really negative impacts of the COVID pandemic.
I felt for people, and because it affected everyone. It's not just people with MS. Every single person on this planet has been affected by social isolation. And do you think social isolation, living with a long-term condition in particular, it's as harmful as smoking cigarettes?
Well, I don't know if we
can we compare these two?
If I can give you any research evidence on that, but we do know that social isolation really affects people's mood, people's anxiety, depression, and unfortunately, there can be a vicious circle, really. So as people with MS maybe develop cognitive problems, or people have a level of disability, then actually there's evidence that worsens your social isolation. So I think and other MS symptoms, and people, obviously, for instance, people who have bladder symptoms, who may become cautious about going out of the house. So the symptoms of MS can also have an impact on your social isolation. So I think it's something that we need to be very aware of for people with MS, because it's detrimental to their overall health. I can't actually provide you with evidence that it's as detrimental as smoking is, but on a serious note, we need to think about this as another risk factor for people with MS.
Yeah, absolutely. What would be your advice, Helen, about collecting the data when you look after the patients? So what would be your advice for healthcare providers to improve people with MS lives from social determinants of health perspective?
Yeah, so I think just incorporating a simple screening tool into your clinic is really important. So I think the more we understand about the individual with MS, the better that we can work together. So if you don't have an understanding of somebody's educational level or current employment, how do we talk to people to explain complex disease modifying treatments? We have to think about the person, think about their understanding of biology. We need to not make assumptions about people's understanding. And so I think it's fairly fundamental, actually, to how we work together with people with MS, that we understand how their life is, and also, things like their relationships, because relationships can be affected. So there can be a lot more going on in people's lives other than, are you compliant with your medication and are your blood tests looking okay?
I was thinking, Helen, about the role of the digital world these days and how much are we influenced by digital social life. Because, and in particular, it becomes very obvious when we've gone into the pandemic, and almost like it feels for me, we should at some stage start calling digital determinants of health.
Yeah, so this is something that we really thought about when we did our review, is digital literacy, actually, because it's another exclusion for some people. So not everybody has the same level of digital literacy and the same access. So I think, we see now, particularly for older people, that, you have to make your appointments on a smartphone. But if you just have an old-fashioned little flip-up phone, then you can't interact with those things. So I think we felt that is possibly going to become an even bigger social determinant of health, actually, in terms of digital literacy. It's not equitable and across society, and we really need to take that into account. And also, how do people with disability, for instance, interact with different platforms, and how can they manage some of the interactions? And I think one thing that came out for me in the COVID pandemic, when we were doing a lot of telephone consultations, is actually older people who had quite severe disability were really kindly much more concerned about me and how are you getting on and how is it at the hospital and everything, but also quite dismissive of their own needs. And, and we're saying that everything was okay. But actually, when I asked them more in detail, they would then say to me, well, actually, they weren't able to walk and they were now, sleeping downstairs, so there had been a significant change, which could have been relapse related, but they weren't reporting it. So I just think we've got to be really conscious that, we don't leave people behind, and that doesn't become another, social determinant of health where people are disadvantaged, really. So, I mean, great possibilities, but it's, and great potential. But I think that we have to bear in mind digital literacy and where people are accessing information.
Yeah, absolutely. So I guess people who are more tech savvy, I guess, sharing their data of the fitness, how many steps they do, and various different biosensors are being developed and integrated in the format of apps and attachable devices to your body and skin. And this is a digital data that, there's no brainer not to collect that data that then influence how we interpret the data and make decisions towards that. If somebody is no longer able to walk, so perhaps the biosensor could send that information and alert to the medical professional that we could then adjust their treatment plan. So I think that's something. It's our future to look forward, and it's needs to be part of our care that we provide. I think the digital technology and the data that we collect about individuals, and there's a lot of sharing the data these days, but there's no brainer not to be part of this, because it influences your outcomes living with a long-term condition in particular. So from your observations, Helen, in terms of the brain health, is anything that we can't, or you cannot prove as yet, but you strongly believe it is true?
In terms of the social determinants of health, I strongly believe that these factors are having an influence on MS disease progression. And I think that, it is really important that neurologists consider these factors, and also that they work hard at, removing any potential biases they may have in how they approach people with MS. So one of the things that did come out was about perhaps bias in terms of race, because there's always been a tendency to think that MS is so much more common in people from a white background, but actually the emerging evidence is that that is not the case. And actually the data from America is showing really increased level in different racial groups. So these are sort of biases that we may have from out of date literature, for instance. So I think, we need now further research. We do know that actually people from different racial groups are underrepresented in trials in MS. So we've got to work really hard at improving diversity in any trials we do in the social determinants of health.
Wonderful. And is there anything that you change in your mind about MS management in the last year, and why is that?
So I'm involved in the UK MS pregnancy register. So I'm part of the steering group for that register. And so some of the changes that have changed my practice have been around how we manage disease modifying treatments in women who are pregnant. So I think, women who are pregnant with MS have, the tendency has always been to stop disease modifying treatments and actually, some people continue to have significant relapses during pregnancy, and they're on highly effective treatments that we discontinue. So I think that has been a change in my practice around, we need to think about these people, women with highly active disease, and how we manage their pregnancies, and looking at how, some treatments we can't continue during pregnancy, but we can continue till, maybe 3 months before conception. So looking at how really, we can support women much better during pregnancy. And then the other thing, from the recent ECTRIMS conference, I think I thought a lot more about cognition and particularly in pediatric onset MS. And I think there were some really interesting things around the impact of pediatric onset MS on cognition and educational achievement, the impact of that. So I think just being much more aware of, are we testing cognition, even in people who are asymptomatic, and particularly in that younger age group, but also can we do more about that? So I'm also involved in a study which is called Neurons, which is looking at early cognitive intervention. And so we need to find out what we can do and does it work, but not waiting until people are really complaining about memory problems, but looking at that much earlier in the disease course.
What a wonderful, Helen, observations that you just made. Such an inspiring way of looking at this condition, and how many aspects may be missed from the day-to-day routine when we see people in our lives. The way we should approach them is more holistic. Is the whole person that has got so many aspects and domains in their lives, and that influences the way they feel, what type of health, how healthy they are, what do they do, what the behaviors, and I'm sure that social determinants have got a huge impact on how people behave in this life, and what they think, what the mindset, what the emotional health they have, and in the emotional intellect, and all various different aspects that we may forget, but it's such an important way of reminding ourselves, and we, Helen, we should keep talking about this, as much as we can. And thank you very much for the publications, the knowledge, the information, the data, the science behind that you bring into this world, and at the international level, so thanks for that, and that's really amazing to hear all these thoughts and information and science behind, and then having the recommendations from you is an opportunity for us. And my sort of last question: what is your quote you live your life by, or you think often, Helen, in this world?
Yes, I thought about this, and I think the most important thing we need to try to do. So my thing is with the person that you're with, whether it's a friend, a colleague, whether it's a person with MS in your clinic, how can you see it from their perspective? So it's seeing it from the other person's perspective, because obviously we have our own perspective in every interaction, but are we seeing things from the other person's perspective? And especially in difficult situations, it can be, that the other person is feeling frightened, or, what's going on for them. So I think that would be one of my perspectives, really. Yeah.
Amazing. This is really powerful. It's looking from people's point of view, and it brings almost empathy into this case, how empathic we are, how social we are, how we feel for each other and our patients. So that's really, really important, Helen. And the very, very last, I promise, this is the last question that Professor Klaus-Müller asks you, Helen, and we tend to sort of to make these podcasts more interesting, and we bring the questions from the previous guests that I interviewed. And his question was, what is your best practice in helping people to start early disease-modifying therapy to preserve the brain health? What communications you get in the clinics, how to convince people that this is so important? Because we do get people who are resistant and they try to avoid the chemicals and medicine. What language do you use to inform people about the benefit bringing highly effective drugs at the very early stage of the MS condition?
Yeah, so I think we are seeing people much earlier now than we used to, which is really positive. So certainly in our service, we are, people who perhaps have seen a general neurologist are very quickly referred to the MS service, although that does vary across the country. So one of the things that we've got to be aware of is that access is not easy for everybody, but we do see people early. And I think I started in MS. It's hard to believe, but before the DMTs, actually. So when I started as a consultant, it was to establish the DMT service. So when I was doing my research, in my initial research, it was pre-DMT. So what is exciting for me is that making a diagnosis of MS now, we have treatments. So what I like to convey to people is how exciting that is for people with MS, actually, that the developments have been incredible. And that, we don't yet have a cure for MS, but we do have treatments that can certainly change the course of MS. And so, so that's one really important thing is, because I have that perspective that, the time was that we didn't have any of these treatments. And then the other really important thing, and it comes back to kind of the thread of this podcast, is about the individual. So it's really understanding what are their priorities. So what are the priorities for that person? So we have developed a decision aid with people with MS from our project called Crimson, which allows people to think about their own priorities. And is it, a young woman who's actually thinking about pregnancy? So how does that influence her treatment choices? Is it, someone who's got real difficulty getting to healthcare settings? So I still think, we're thinking early, but we've got to think early with the individual and their own circumstances.
Wonderful, Helen. I think it's part of the being of evolution. Being a healthcare provider, looking after the patients and seeing how things change is really, really impactful, and you bring a lot of reassurance to people with MS when they come to see you, because they strongly believe that you witness people who were not on disease-modifying therapies, who are now on disease, and what the outcomes are following the introduction of the powerful disease-modifying therapies to preserve the wellness, the brain health. General health is really important, and how they influence each other when you haven't got diabetes, hypertension, and living with MS. And that's our target and goal, I guess, to optimize the general health for people with MS. So thank you so much. And now we expect a question from you, Helen, to the following guest that is coming, hopefully next week. And what would be your question?
So my question would be to the next MS specialist. Do you ask people with MS about social determinants of health in your clinic? And if so, which social determinants do you ask about?
Wonderful. Thank you so much. I enjoyed to the huge extent talking to you, Helen. Thank you for coming.
Oh, thank you very much. It's been really lovely to discuss all of these complex issues with you. Thank you.
Thank you so much.